Hello everyone and welcome back to Rehab with Dr. Mohit. If your loved ones has had a stroke, you may have noticed something strange happening after a few weeks. Whenever they try to lift their arm, the whole arms bend together in one fixed movement. Or when they're walking, their legs swing in a semicircle and you wonder why is the body doing this? Is something going wrong or not? What you are seeing has a name, it's called synergy pattern, and I'm going to explain exactly what it is, why it happens, and at which stage the recovery appears, and most importantly, how to break the synergy pattern and recover better with movement. I will also explain the PNF pattern, which is a very important technique in physiotherapy, and in a very simple language to every so that every patient and every family member and caregiver can understand it easily. So please watch this video till the end because every section builds on the last. Let's begin. So first, what exactly is the synergy pattern? Let me explain this with a very simple example that everyone can relate to. Imagine your television remote has only one button. Yes, press it and the volume goes up, the channel changes by itself all at the same time. You cannot control them separately. Either everything happens together or nothing happens at all. This is exactly what a synergy pattern is in stroke patient. After a stroke, the brain loses its ability to control the individual muscles at a time. So when the patient tries to move one part of the limb, the entire limb moves together in the fixed automatic pattern. The patient cannot pick or choose one movement, everything fires together and at once. Now, in the upper limb, in the arm, the pattern looks like this, and in shoulder rotates inward, the wrist bends down, and the fingers curl into a tight fist. So, together, this is called a synergy pattern. And in the lower limb, the leg, the flexor synergy looks like this. The hip bends, moves outward and rotates to the outside. The knee bends, the ankle pulls upward. Again, all together happens in a one pattern. So something there is also called external synergy in the lower limb. External synergy causes the hip to extend and rotate inward, the knee to straighten and the ankle to push downward and inward. This is actually what causes that stiff swinging walk that many stroke survivors have. The leg becomes like a stick and swings to the half circle or semicircle movement. So now you know exactly what is happening. So why does this happen all at all? After a stroke, the higher brain centers, the cortex, which are responsible for fine selective individual muscle control, are damaged. So the lower brain centers, especially the brainstem, take over, and the brainstem only knows how to produce mass movement patterns. It does not know how to move one muscle at a time, so the body defaults to these grouped automatic movement patterns. These are synergy patterns, and this is extremely important for families to understand. This is not the patient's fault, it is not laziness, it is not lack of effort, it is simply how a damaged nervous system responds. The brain is doing the best it can and what it has left. Now let's talk about the stages of recovery because this is one of the most common questions I get: at which stage does synergy pattern appear? In physiotherapy, we use a system called the Brainstorm stages of stroke recovery. There are six stages and they describe the journey from complete paralysis to near normal movement. Let me walk you through all six stages. One, this is immediately after the stroke. The affected side is completely flaccid. There is no movement whatsoever, no muscle tone, no reflexes, nothing. The limb just lies there like a wet cloth. There is no synergy pattern in the stage because there is no muscle activity at all. Stage 2, now the muscles begin to wake up, the muscle tones start to develop, and this is where synergy pattern begins to appear, but only partially and only in response to the stimulation. If you touch the arm or if the patient tries very hard to move, you might see a small incomplete attempt at a synergy pattern. This is the nervous system starting to come back online. And then stage 3, this is the peak of synergy pattern. This is the stage where synergy is at absolute strongest. The patient can now move the limb but only in full synergy. This cannot do anything outside the pattern. Spasticity is also at its highest in this stage. This is often the most difficult and frustrating stage for patients and their families because there is movement but it is completely grouped and uncontrolled. I want to tell every family watching this, stage 3 is not a bad sign. It means the brain is recovering, but it needs your support and consistent physiotherapy to move forward. Stage 4, now real recovery begins. The patient starts to show small movements that are outside the synergy pattern. For example, the elbow can extend a little while the shoulders is in some flexion, something that is impossible in pure synergy. Spasticity begins to decrease. This is a very positive sign and should be celebrated. Stage 5, synergy is mostly gone. The patient can now perform more independent joint movements. Complex combinations become possible. Function improves significantly. Stage 6, movement is nearly normal. Speed and coordination may still be slightly reduced compared to the unaffected side, but individual joint control is largely restored. So, to summarize the stages, synergy pattern begins in stage 2, is the strongest in stage 3, and gradually breaks down from stage 4 onwards. Your goal and our goal as physiotherapists is to guide the patient from stage 3 towards stage 4, 5, and 6. Now, let's talk about the PNF pattern. I know it's a very long and complicated name, but let me break it down word by word and it will make complete sense. Proprioceptive, this refers to the body's own sense of its position and movement. You know where your hand is even when your eyes are closed. That is proprioception. Neuromuscular, this means that connection between nerves and muscles, how they communicate and work together. Facilitation, this simply means making something easier, encouraging it to happen. So PNF means using the body's own position sense to encourage better cooperation between nerves and muscles. That is also it is. Now here the key reason why PNF is so powerful against synergy patterns. Synergy patterns are straight movements, simple flexion or extension in one direction. PNF patterns are diagonal and spiral. They move across the body, they combine rotation, and this diagonal rotational quality is the complete opposite of what synergy wants to do. So when we make the patient perform a PNF diagonal movement, it breaks the brain's habit of defaulting to synergy. It forces new neural pathways to activate. It challenges and wakes the muscles that are being suppressed or ignored because of synergy dominance. Let me explain the main PNF patterns for the upper limb. The first pattern is called D1 flexion. In this movement, the arm starts from a position where it is extended, rotated outward and out to the side, and it moves diagonally upward, crossing toward the opposite shoulder. Think of it like pulling a seat belt across your chest. The shoulder flexes and move inward. The forearm rotates and the wrist and fingers extend open. This movement breaks the typical upper limb flexor synergy beautifully because it combines shoulder adduction and wrist and finger extension. Two things synergy would never put together. The reverse of this is D1 extension, going from the cross position back down and out to the side, like pushing something away diagonally. The second pattern is called D2 flexion. Here the arm starts from down and across the body and moves diagonally upward and outward, like drawing a sword from a scabbard on your opposite hip and raising it up above your head. The shoulder flexes and moves outward. The wrist and fingers extended. The reverse is D2 extension, going back down the across. For the lower limb, similar diagonal pattern exists. For example, D1 flexion of the leg involves the hip flexing with the leg moving inward and rotating internally, the knee bending and the ankle pulling up with the foot turning outward. Notice how this is complete opposite of the external synergy pattern that causes that stiff walking gait. This is intentional. PNF directly challenges and counters synergy. Now the most important section, how do we actually fight synergy pattern and helps recovery? First, please understand this fundamental principle: you cannot fight synergy by force. If the arm is pulling into flexion due to synergy, you cannot just push it straight with force. That will trigger more spasticity and more resistance. The approach must be intelligent and layered. The first approach is positioning. This is something caregivers can do all day, every day at home without any special equipment. How the patient is positioned matters. The affected limb should be positioned against the synergy pattern whenever possible. If flexor synergy is pulling the arm up and inward position, it gently extended slightly away from the body with the palm facing upward. Support it with pillows. Do this during rest, during sitting, and during sleep as much as possible. This sends constant sensory input to the brain that this position is normal, and it reduces the dominance of the synergy pattern over time. The second approach is gradually breaking the pattern with small movements. Before we can do full PNF diagonals, we first try to achieve small out of synergy movements. For example, getting the elbow to extend it slightly while the shoulder remains in the some flexion, or getting the shoulder to flex without the elbow immediately bending along with it. These small victories are the first crack in the synergy pattern and the beginning of stage 4. The third approach is rhythmic initiation. This is a PNF technique where the physiotherapist first moves the limb passively through a diagonal pattern. Then patient does nothing, just relaxes. Then the therapist asks the patient to assist a little, and gradually the therapist reduces assistance as the patient gains control. The rhythm and repetition help the brain begin to learn the new movement pathway. The fourth approach is the hold relax technique. When the limb is stuck in synergy due to spasticity, the physiotherapist takes the limb to the point of resistance and then asks the patient to gently push isometrically against the therapist's hand. Not a full movement, just a gentle push and hold. Then the patient relaxes completely. After this relaxed phase, the therapist can gain more range of motion. This is very effective for tight elbows, tight wrist, and tight hip adductors in stroke patients. The fifth approach is slow reversal. The patient alternates slowly between two opposing PNF pattern, flexion, diagonal and extension diagonal, in a controlled rhythmic manner. This trains the brain to switch smoothly between muscle groups, which is precisely what synergy disrupts. And the sixth and perhaps most important factor is active participation. The patient must try even if the movement produced is very small. The intention to move is to what matters. It is the voluntary effort that drives neuroplasticity, the brain's remarkable ability to rewire and rebuild connections. Passive movement helps maintain range and provide sensory input, but it is active movement, however small, that truly changes the brain's wiring. For caregivers at home, you may not be trained in all these PNF techniques, and that is completely fine. Here is what you can safely do at home. Perform the gentle range of motion exercises exactly as your physiotherapist has taught you. Make sure your loved ones is not resting or sitting in a posture that forces the synergy pattern, and most importantly, encourage the patient to use the affected hand during the activities. Even try touching glass, holding a tissue, placing a hand on a table. Repetition of functional movement is medicine for the recovering brain. So before I close today's video, I want to share 5 very important tips, especially for family members and caregivers. Tip number 1: do not panic when you see synergy pattern. Synergy appearing in stage 2 and 3 actually means the brain is waking up. It is a sign of recovery only. Work with your physiotherapist, follow the exercises, and guide the patient forward through the stages. Tip number 2: consistency is more important than intensity. 30 minutes of physiotherapy once a week is far less effective than 10 to 15 minutes of proper exercises done every single day at home. Build a daily routine, even a small number. Tip number 3: encourage but do not do everything for the patient. Many loving caregivers do all the tasks for the patient because they want to help, but this actually shows recovery. Let the patient try, give them time, support them if they are struggling, but always give them the first opportunity to attempt the movement on their own. That effort is what rewires the brain. Tip number 4: watch for something called learned, not used. This happens when the patient stops trying to use the affected limb because it is difficult and frustrating, and over time the brain forgets it even more. If you notice your loved ones always ignoring the affected side and doing everything with the stronger side only, please bring this to your physiotherapist's attention immediately. Tip number 5: celebrate every small win. Moving from stage 3 to stage 4 may look like a tiny movement to an outsider, but it is a massive victory in terms of brain recovery. Acknowledge it, celebrate it. Positive reinforcement and motivation are genuine fuel for neuroplasticity. So to bring everything together from today's video, synergy pattern is the brain's way of moving in grouped automatic patterns after a stroke because selective individual muscle control has been damaged. It begins to appear in brainstorm. Stage 2 is at its strongest in stage 3, and it begins to break down from stage 4 onwards. PNF patterns are diagonal and spiral movements that directly challenge and counter synergy, forcing the brain to build new movement pathways that are more selective and functional. And recovery from synergy happens through small positioning, gradual out of synergy movement. PNF techniques like rhythmic initiation, hold, relax, and slow reversal combined with the daily home exercises and consistent active participation from the patient side. Stage 3 is not the end, it is the middle of the journey, and with the right guidance, the right exercises, and consistent daily effort, your loved ones absolutely can move forward. If this video helped you understand your loved one's condition better, please share it with the family members and caregivers who are going through the same journey. Every share helps one more family get to the right information. If you have any questions, drop them in the comments. I read every single comment and I will answer you. And if you are not yet subscribed to this channel, please subscribe and hit the bell icon so never miss any video of stroke rehabilitation. See you in the next video. Keep going. Recovery happens on one movement at a time. That is why I am offering a one-on-one consultation with you. So we will do a complete assessment on video call, confirm the brainstorm stage, identify your muscle tone and whether it's flaccid or spastic or a mix, build a personalized plan for you and how to do all these 4 techniques and teach you and what are the do's and don'ts at home. And along with that, you will receive a complete home rehab protocol, week by week exercise plan, daily routine, schedule, progress, tracking sheet, 30 days of WhatsApp support. To book your consultation, the link is in the description. Click and book your appointment through WhatsApp or simply comment in consult down below and we will reach out to you. So that it will help a lot of other patients also, and every stroke client is important, so they can also get a chance to learn the new techniques, the difference between flaccid and spastic muscles, and then what the stages of brainstorms are. For a consultation, comment consult. For WhatsApp updates, comment updates. Okay, see you in the next video. Thank you so much. Take care. Good night.